Hello and welcome to the Healthy Lifestyle 365 channel, your reliable guide to healthy and happy aging. Today we will talk about something that bothers millions of older people every day: leg pain. Perhaps your legs hurt after walking, or you have trouble finding a comfortable position at night. Don't worry, I'm here to help you understand the causes of leg pain and, most importantly, find relief. What causes leg pain? Let's start with the basics. Why do our legs hurt more as we age? There are several reasons. 1. Arthritis. This common condition causes inflammation of the joints, leading to pain in the knees, hips, or ankles. 2. Poor circulation. As we age, our blood vessels become less flexible, making it harder for blood to flow. This can cause cramps or heaviness, especially in the calves. 3. Nerve problems. Conditions such as sciatica, peripheral neuropathy, or restless leg syndrome can cause tingling, burning, or painful sensations. 4. Muscle strain. You don't have to run a marathon to strain your muscles. Even everyday activities such as gardening or long walks can cause leg pain. Tip 1. Daily habits and light exercise. Movement is medicine. Here are some recommended exercises and routines. Seated leg stretch. Sit up straight and gently stretch each leg, holding the position for a few seconds. Ankle rotation. Improve circulation by rotating your ankles in both directions for 1 minute. Calf and thigh stretch. Do a light calf stretch using a chair or wall for balance. Walking. Start walking frequently for at least 5 to 10 minutes a day, even inside your home if necessary. Start slowly and listen to your body. Even light activity can reduce stiffness and pain. Tip 2. Home remedies. Let's talk about quick relief. Here are a few examples and demonstrations. 1. Warm compress. Boil water and let it cool slightly to a comfortable warm temperature. Test it with your hand. The water should be warm, but not hot. Soak a towel in warm water and wring it out thoroughly so that it is damp but not dripping. Apply the warm towel to the affected area of the leg. Optional. Cover the compress with plastic wrap to keep the heat in longer, and cover with a dry towel for extra warmth. Keep the compress on for 15 to 20 minutes. Important to remember: never use water that is too hot, especially if you have impaired skin sensitivity. Do not overcool your feet after the procedure. The procedure can be repeated 2 to 3 times a day. When a compress is contraindicated, if there are open wounds, severe inflammation, or suspected thrombosis. Be especially careful if you have skin sensitivity disorders, for example, diabetes. 2. Ice compress. An ice, cold compress helps for fresh injuries, bruises, sprains, dislocations, especially in the first 24 to 48 hours after the injury. For swelling or edema, to reduce inflammation. For acute pain after physical exertion or injury. For insect bites, to reduce itching and swelling. Caution: do not use ice for numbness, circulatory disorders, or open wounds. How to apply an ice pack correctly. Prepare ice. You can use ice cubes in a bag. Frozen foods, for example, a bag of peas, or a special gel cold pack. Be sure to wrap the ice in a cloth. Do not apply ice directly to the skin. Use a thin towel or napkin. This will protect the skin from frostbite. Place the compress on the area of swelling or pain. Keep the compress on for 10 to 15 minutes, no longer. You can repeat the procedure every 2 to 3 hours, taking breaks between procedures. Important: if numbness, severe redness, burning, or a feeling of coldness occurs, remove the compress immediately. Do not use a cold compress if you have a skin sensitivity disorder, diabetes, or other neuropathy. Consult your doctor first. If the pain and swelling do not go away or get worse, see your doctor. 3. Elevation. Lie down on a sofa or bed and place your feet on pillows above the level of your heart. 4. Self-massage. Give your feet a light massage, moving in the direction of the heart. Tip 3. Prevention and lifestyle. Healthy habits are extremely important. For example, shoes with good support. Shoes with good support are shoes that provide proper foot positioning, cushioning, stability, and reduce stress on the joints. They are especially important for people who walk or stand a lot, play sports, or have foot problems. For example, flat feet, heel pain. Examples of shoes with good support. Orthopedic sandals. For example, Birkenstock with anatomical arch support. Everyday shoes with orthopedic insoles. Sports basketball or tennis sneakers with high arch and heel support. Why shoe support is important. 1. Injury prevention. Good arch and heel support reduces the risk of sprains, flat feet, heel spurs, and other injuries. 2. Pain relief. Support helps relieve tension in the muscles and joints of the lower extremities and back. 3. Improved posture. Proper footwear promotes healthier, straighter posture. 4. Increased comfort. Quality support makes wearing shoes for long periods of time more comfortable and less tiring for the feet. Hydration and nutrition. The role of water and minerals, potassium, calcium, magnesium, in muscle health. Consume foods such as bananas, spinach, and dairy products. Rest. It is acceptable to rest. Balancing physical activity and rest is a key factor in effective recovery, especially for older adults and those experiencing foot pain or joint disease. Why is balance important? Activity helps strengthen muscles, maintain joint flexibility, and improve blood circulation. Without movement, muscles weaken, joints become stuck, and metabolism deteriorates. This can increase pain and swelling. Rest allows tissues to recover after exercise, reduces inflammation, and prevents chronic fatigue. Without sufficient rest, the body does not have time to heal microdamage, which increases the risk of new injuries and constant pain. How balance helps with recovery. It relieves tension and reduces inflammation. Alternating movement and rest allows joints and muscles to work without overexertion. It promotes blood circulation. Light activity drives blood through the vessels, which brings oxygen to the tissues and removes waste products, while rest helps these processes to complete and accelerates healing. At rest, the body directs more resources to the restoration of damaged areas. There is active construction of new cells, reduces the risk of re-injury. Moderate activity strengthens muscles and joints, while rest prevents them from becoming overworked. How can you find your balance? Do simple exercises or take walks throughout the day, but don't push yourself to the point of exhaustion. After being active, be sure to take time to rest, sit or lie down, and you can slightly elevate your legs. Listen to your body. Pain or severe fatigue after a small amount of exercise signals the need for more rest. Remember, alternating between activity and rest is the best way to recover and prevent chronic pain. Don't strive for maximum effort, but maintain a moderate level of movement that is comfortable for you. If you are unsure which regimen is right for you, discuss it with your doctor or physical therapist. Tip 4. When to see a doctor. In most cases, leg pain is not serious, but some signs mean you should seek help. Sudden severe pain, swelling, redness or fever could be signs of blood clots, numbness, weakness, or loss of mobility. Pain that does not go away within a few weeks despite self-treatment. Dear friends, I would like to remind you once again, if you have new pain in your legs or the discomfort has started to get worse, do not hesitate to see a doctor. This is not a sign of weakness, but rather a sign of caring for your own health. Sometimes asking your doctor a question at the right time can help detect a problem at an early stage and avoid complications. Your health is your most valuable asset. Don't endure pain and don't put off seeing a specialist if something is bothering you. The sooner you get professional help, the faster you can return to an active life and enjoy every day. Don't forget to ask your doctor questions. It's normal and important. Take care of yourself. Friends, if you have your own proven home remedies for leg pain or ways to relieve the condition, be sure to share them in the comments below this video. Your experience may be useful to other viewers of our channel. If you still have questions or would like to learn more about a topic, feel free to write in the comments. We always read your messages and try to make new episodes on the topics that interest you most. Let's help each other. Share advice and ask questions. Together, we can overcome any problem. Today, we looked at the causes of leg pain, ways to treat it, and situations when you need to see a doctor. Remember, you don't have to endure pain or deal with it alone. There are solutions, and there is a community ready to support you. If you found this video helpful, please like it and don't forget to subscribe to get more tips tailored specifically to you.